Hi everyone, my name is Ellie and in today's video I'm going to be giving you my top tips on how to ace your medical school interviews. So I had interviews at 4 different medical schools and fortunately I got offers from all of those medical schools. So I must have done something right in my medical school interviews. So in today's video I want to give you guys some advice on how to prepare for your medical school interviews and then give some more practical advice on the actual interview itself and how to react to certain questions. My first piece of advice is to practice, practice, practice. Do as many mock interviews as you can. Get your family members, your friends, your teachers to give you mock interviews because the more practice you have, the better, because ultimately the essence to acing the MMI stations is to be able to give answers in a concise and meaningful manner. So if you practice and get your family and friends to give you feedback and constructive criticism, then you can improve and progress on your interview technique so that on the actual day you aren't rambling, you aren't telling a story, you are getting straight to the point and answering the actual question at hand, because this is really important for places, especially like Exeter University, where their MMI stations are only 3 minutes and you have to answer 3 questions within that time. So it's imperative that you are able to deliver an answer in a short amount of time, but also give a good quality amount of content in there to actually answer the question. So the next thing I did was I created some knowledge flashcards. So the medical schools won't expect you to know facts and figures about certain diseases. They won't expect you to know the ins and outs of the NHS or the human anatomy. However, it is really good to have a general understanding of the workings of the NHS and certain hot topics in medicine, which you can actually find on the Medic Portal website. So certain things that I did was I made a flashcard about the junior doctor contract, for and against points for the privatisation of the NHS, how Brexit is going to affect the NHS as well. So there's lots of different things that you can do and that you need to learn. So I think the main ones are more about privatisation of the NHS, the NHS 5-year plan, how the NHS medical training works. So when you leave medical school, you do your foundation years of training, then you go on to specialised training. So just do flashcards on that so that you have a good general understanding, so that if it were to come up on your interview, you are competent in those areas. Whilst practicing your interview skills with someone is preferable because they can give you good feedback, you can also kind of practice for your interviews independently. I did this by creating mind maps. So essentially I basically looked at the Medic Portal website and I looked at the MMI most common questions and I pretty much made a mind map for each one. There's probably a good 40 mind maps in the end. Whilst I don't ever advocate reciting or memorizing an answer, because honestly if you do that the interviewer will see straight through it and they do not like memorized answers, I would definitely suggest for popular MMI questions having a few points in your head that you can elaborate on. So an example being is, this is a typical one: what qualities do you have that will make a good doctor? So what I did was I put my kind of top points and then I evidence them. So for example, taking time to listen and communicate properly. I talked about when I had to talk to people with communicative difficulties when I was doing work experience at the brain rehabilitation unit. So if I was independently sat in my room trying to practice for the interview, I would give a model answer to this question, and afterwards I would look at the points that I've put on here and see if there was any really good points that I missed or if I could have elaborated further on certain points. So whilst it's not reciting and memorizing, it's really good as it will help you get those key points in your mind that you can literally just spiel off in the interview. I also recommend doing these mind maps for your different work experience placements. So this is one from my brain rehabilitation unit. I just put all the key kind of things that I saw and things that I learned on here, so that when I practiced talking about my brain rehabilitation work experience, afterwards I could look at this and see any points that I missed. And then another really popular MMI question is, why do you want to go to this medical school? Why does this course appeal to you? So ensure that for each medical school that you've got an interview for, you do write a list of kind of things and factors that make you want to go to this medical school. So for like Birmingham, I put about, I really like problem-based learning. I put a few points why I like that. And then I also wrote a list of the best parts of the course, so that when I got asked that question in the interview, which I actually did, I could just reel off a load of points and just show that I was very knowledgeable about the course and I knew what I was getting myself into. In the interview, they will expect you to talk about your personal qualities, but then they will also want to know about your interest in medicine. So a really popular MMI question is, what medical news have you read recently? So I recommend preparing for that by writing and kind of summarizing an article that you've read about. So for me, I talked about artificial wombs in my interview, and I basically prepared a little kind of summary answer for that. I also didn't memorize or recite an answer. I just put down the main points and then I discussed that in my interview. So I recommend having an example ready, because if you're anything like me, I will read a news article and forget about it really quickly. So you need to make sure you choose an example and then you're able to talk about it and summarize it to a good standard. Following on from the medical interest point that I just made, make sure you do read the medical news every morning so that you do have a well-rounded view of medicine and that you're up to date with the hot topics in medicine. Because on one of my interviews, I was actually asked, tell me an example of medical negligence that you have read in the news recently. And of course, if I hadn't been reading the medical news religiously like I had, then I would have no idea what to say. So make sure that you're not only reading about medical research, but about the NHS, patient stories. Just read a wide range, because that will help you answer those really tricky questions in the interview. I know this seems like it's going on forever, but trust me, I've only got a few points left on preparation for interviews. But my next thing is get a medical interview book. I will put or insert a picture of the one that I used, and I found this particularly helpful for the ethics questions, because I was finding it really difficult how to model my answer for an ethics question. So this book gives you a load of different examples of ethics questions. You can read through it and then kind of understand how to formulate an answer. It's really important that you practice answering ethics questions, because they will definitely come up. On one of my interviews, I had 3 of them. So you need to be able to train yourself how to give a well-rounded argument that isn't just your opinion. You need to consider both sides and both perspectives and give a well-rounded answer with ethics questions. So for example, a really popular one that comes up is something like, you've got a donated kidney, there is a child who has some sort of disease that means that his kidney doesn't work, and you've got an ex-alcoholic mother who has 2 children who needs a kidney. Who do you give the kidney to? So it's really important that with difficult questions like that, where you have to consider multiple points and arguments, that you do practice, and also refer to the 4 pillars of medicine, which is autonomy, justice, non-maleficence and beneficence. But you can go to the Medic Portal website to read up more about that. Last couple of things I would say is that a lot of the medical schools actually host some advice or do some videos on YouTube about their interview process. Keele certainly did, Birmingham did as well. So make sure you access those resources, as it will better prepare you for the interview. Then another thing I would say is, if you're feeling really unconfident about the interview, then definitely consider going to an MMI course. I personally didn't do one, but from other people I know who did one, it really helped them, and it just helped them get that confidence and preparation that they needed for the MMI. Now I'm going to move on to my advice for the actual interview itself. The first and most important thing I want to address is that, of course, it is so natural to get nervous. It is a very stressful and scary time, and I feel like the anticipation of just waiting for the interview is so nerve-wracking. But once you get into that interview, you need to be calm, confident and collected. You need to ensure that you're not stuttering over your words. You need to just take a deep breath and almost pretend that you're just having a conversation with the interviewer. Just please don't fall into a trap of nervousness and be trembling and shaking and stuttering on your words, because it just won't look very good. Because if you think about it from the interviewer's point of view, they're assessing their candidates' ability to deal with high pressure situations. Because let's face it, MMIs are extremely high pressure, so they want to find candidates who can deal with that pressure, because then it justifies to them that these candidates, when they are put in a high pressure hospital situation, that they will stay calm and collected to give the best possible care to the patient. Therefore, if you are a trembling, nervous mess, then that won't justify that fact to them. They will think, oh, maybe you can't deal with the pressure of medicine. So just try and stay as calm as possible. And as I said before, just treat it like a conversation. That's what I did. And ensure that you flex every single experience, every single role and responsibility you had. You are there to prove to them that you are the right candidate for that medical course. So ensure that you throw out everything and just sell yourself. What I'd also say is that getting an interview is almost the hard part. You have to beat off probably 5 or 6 applicants to get to the interview stage, whereas once you're at the interview, you only have to beat off like 1 or 2 applicants. So just remember that the medical school has asked you to the interview because they believe that you are a potentially good candidate for their medical school and they want to get to know you. So just believe in yourself and walk into that interview knowing that you have the potential to get an offer. So just show them what you're made of and all that you've got, because really you've got nothing to lose at that stage. So just believe in yourself and remain confident. I won't lie to you, the moments when I sort of lost confidence in the interviews was when the interviewer had a really good poker face, because you're kind of saying something and they don't react, so you think, oh gosh, am I saying the wrong thing? Is this incorrect? Should I start again? But my advice to you is just don't even think about the interviewer, don't look at their face. Well, obviously look at their face, you need to make eye contact. But what I mean is just don't register what's going on in their face. Just if you believe in your answer, then just keep going and just hope for the best, really. Another thing I'd recommend is actually talk to the fellow applicants before your interview, because there's no point really looking at your notes before the interview because none of it will actually sink in. So you may as well just talk to the people around you. My least favourite interview was definitely Keel, and the only bit that got me through that interview day was just talking to the fellow applicants. We had a good half an hour to wait before our interview and we just shared our UCAT horror stories and just talked to each other about the process. So it's really nice to talk to them because it really calms your nerves, and just knowing that you're not alone is really, really nice. Do not panic if you have lost your train of thought. This has definitely happened to me in the MMI. Sometimes, you know, the pressure of the situation gets to you and you just completely forget what you're going to say. So don't panic. You know, the interviewers know that you're human. It is a high pressure situation, so they will understand if you do lose your train of thought. So just start again, and well, obviously don't just randomly start again. Do tell them, oh, I forgot what I'm saying, can I start again? And they're more than happy to let you do that. So now I'm going to run you through some tips on particular stations. So on stations where you're asked to talk about your work experience, it's imperative that you do not tell a story or you do not just list things that you saw. You need to kind of state what you saw and then show what you learned from it, how you have reflected, how it will make you a better doctor, how it will help you in your medical career. You need to reflect because, you know, you could have watched open heart surgery, which is absolutely fantastic, but they don't really care if you haven't actually learned anything from it. So you need to always refer to what you learned from your work experience and how it will influence your future career as a doctor. The station I was actually most nervous about in the whole MMI process was actually role plays, because I just thought it would feel like the most unnatural, weird thing, and I thought I would just get really awkward. But actually, most role plays are really nice. It just feels like you're having a general chit chat and conversation. However, I must say, there was one particular role play where the actor started crying, and it was honestly the most awkward experience of my life. So there is a possibility that some role plays can feel absolutely horrendous. It felt like the longest 4 minutes of my life. So what I'd recommend to you is actually practice kind of giving bad news to your friends and family. This is something I did not do, and I kind of regret it because I kind of just had no clue what to say when I was in that situation where an actor started crying and I had not a clue how to react. So make sure you do practice your role plays. In terms of maths and data interpretation stations, with the math stations, it's all like GCSE maths, so just make sure you take your time and check your calculations, because you don't want to miss stupid marks because you haven't put in the calculations properly, or you've rushed it. And same with data interpretation, ensure that you read the axes properly, you make sure that you understand the data that is given, because when you are to talk about it in your station, you need to be very clear with what you're saying and make sure that you reference to the data correctly. Because on one of my first interviews, I kind of misinterpreted what the data was about, and that kind of ruined the whole station. So make sure you're very careful, read the axes clearly, and have a good understanding. Finally, the last thing I'm going to say is that it's okay to have a bit of silence at the end. Some of the MMI stations, I would have maybe a minute left, I couldn't say anything else. Please, in that situation, if you've got nothing new to say, then don't say it. They don't want you to just ramble for the remaining minute. You may as well just sit in silence. But if you do have something else to say, then please do say it. And when the timer goes, just stop. You're not allowed to say anything past that point, so just get up and walk out. So yeah, and just don't be afraid of the silence. It can feel really awkward. I remember on my first MMI that I had, there was a minute of silence at the end, and I was just trying to rummage through my brain, like, Ellie, think of something, because I thought, oh gosh, he's going to think I'm incompetent, I don't know anything. But it's just better to just sit in silence rather than just ramble, because they don't like you repeating yourself. So that's the end of this video. I know it's been quite a long one, but I really hope it helps you. I know how stressful and horrible the MMIs can be, so just try and stay calm, and remember that the reason that they've asked you to that interview is because they can see you as a potential candidate for their medicine course, and they want to get to know more about you. So just show yourself off, flex any experiences or roles or responsibilities that you have had, and just show them what you're made of and prove to them that you are the right candidate for their medicine course. So if you've got any more questions, and please don't hesitate to leave them down in the comment section. Make sure that you like and subscribe, and yeah, I'll see you in the next video.